Thanks for joining us for this COVID-19 and City News briefing for Monday, November 16th. I hope everyone had a good weekend. We'll start with today's test numbers. These are all of the system-wide numbers for Forest General, Hattiesburg Clinic, Merritt Health Wesley, Simrai, and the Moffitt Health Center at USM. As of this morning, 84,072 tests had been conducted, with 9,149 of those positive, 74,762 are negative. We have 161 tests currently pending. In the hospital today, between Merritt Health Wesley and Forest General, we have 62 people who are COVID positive. That's 6 over where we've been for the last 2 weeks, with another 2 under investigation. And of those 62, 20 are in the ICU right now, which is just under where we've been for the last 2 weeks. As you can see this on this last part of this trend line, ICU admissions have dropped down a little bit. However, overall hospitalizations, which were lingering in the mid-50s, have now crossed the 60 threshold. Statewide today, there were 589 new cases reported and 2 new deaths. I will say that 589 typically reflects Sunday's testing amounts, which are usually lower than what you would normally see in terms of test volumes Monday through Saturday. However, even with those lower test volumes, 589 new cases, 22 of them came from Forest County. And as you can see, it was not a great weekend for us in terms of new positive cases. 36 on Saturday, 25 yesterday, 22 today. Lamar County saw 16 on Saturday, 14 on Sunday, 7 today. So overall over the weekend, 120 new cases in the metro area. Since this began, 3,448 have been total positives in Forest County, with 2,604 in Lamar County. Our 5-day average, this is kind of a tale of 2 counties. Lamar County has really continued to pull their 5-day average down to the low teens. Forest County, however, with about 5 or 6 days in a row, double digits. Forest County's inside 14-day average is almost 30, and so that's a concern that we'll talk about in a second. That also manifests itself in the inside 14-day number. The inside 14-day number is the number of people who've received their positive test result within the last 2 weeks. It gives you an idea, although imperfect, an estimate on how many active cases you can have in your community. Forest County's number now stands at 272. Lamar County's now stands at 213. And kind of a tale of 2 different counties. Lamar County's number has dropped below Forest County's over the weekend, low 200s, while Forest County has seen kind of a concerning increase that we'll mention in a second. Week over week, Forest County this last Monday was 218 inside 14 days. Again, active cases potentially 272 this week, so quite an increase there. Lamar County dropped from 239 to 213. Overall cases now at 485. Hospitalizations also increased a little bit, 59 to 62 last Monday to this Monday. ICU admissions, though, dropped 26 to 20. Our goals continue to be protecting the vulnerable, people over the age of 60, people with underlying chronic health conditions, preventing the overrun of the healthcare system. So there are the space and the people and the equipment needed to take care of you if and when you need healthcare in a healthcare setting, and then prioritizing public health while keeping the private sector open. So a couple of concerning trends as we hit the first day of a new week. We give you these so that they can inform your decision making as you start your day tomorrow. Hospitalizations have reached over 60 for the first time since September 13th. We've had a good 2 months since we've seen hospitalizations this high. Furthermore, Forest County's inside 14-day number, again, that estimate on active cases, has increased by 73 in just 5 days. We were knocking on the door of 199, 200, and we've jumped that much in just 5 days. And again, those active cases will eventually translate into hospitalizations, ICU admissions, and worse. And so we give you these things because now is the time to change course. Before we get to a July-type spike, we can see the numbers going that way, and we can change course. We can change our behavior individually and collectively. We saw this increase the first part of October, but we changed course and brought those numbers down. And there are a few simple things that we will continue to preach that can help do that. Individually, you can wear a mask, you can practice social distancing, and you can avoid large crowds. Those are things that we can do that can help start to bend this curve, because we don't want to see a July spike, particularly as we go into the holidays. Part of that also means making wise decisions when it comes to Thanksgiving gatherings. I know it's been a long year. I know that many of the traditions and other times of year we've had to put on hold. I know that we want to see family and friends, particularly those who have had to isolate themselves because they are vulnerable. But COVID isn't gone anywhere. And those people who are were at risk throughout the year are still at risk now. And so you need to really think long and hard about bringing people who are vulnerable, whether they're because they're elderly or because they have pre-existing conditions, into close contact with those who have been around a lot of people or school-age children, things like that. Now, if you want to go back to last Monday's briefing where I talked to Dr. Rubosh, he gives you some creative tips on how you can mitigate that risk. But when you're in close proximity and people with family, people don't want to wear masks, and they want to be close, and they want to hug, and they want to have conversation. Those things can attract and increase risk of transmission if someone is sick. And so obviously we want people to be with family. We want them to have good mental health, especially going into the holidays. But just again, make wise decisions when it comes to how you do family gatherings this Thanksgiving. Some city news. Paving crews were out in Ward 5 and Ward 2 last week. Continue that today. Shelton Drive and County Drive were paved last week. They're going to be moving on to more of Ward 2 and 5 this week. Also want to congratulate our high school football teams who were victorious last week. Hattiesburg High defeated South Jones 50-10. They now will travel to Pascagoula in the second round of the playoffs. Oak Grove defeated Biloxi 54-34. They will now move on to play, I think, Harrison Central. I want to congratulate PCS and Petal. PCS had a historic season this year. Came up short against Madison Ridgeland Academy, but great jobs to both these teams on their seasons. And of course, Summerall and Lumberton will be advancing on to the next round of the playoffs as well. So congratulations to all our student athletes in a very challenging season. And finally, our act of courage. This act of courage is an opportunity for you to take part in meeting a specific health need that we have right now. There is a critical blood shortage, as there has been throughout this pandemic. And if you have not given blood in a while, we encourage you to stop by Main Street United Methodist Church this Wednesday, November 18th, from 3:30 to 6:30 in the Fellowship Hall. You can go to violent.org for more information, but this is a chance for you to show active leadership and to help meet a need that we have right now, and that is a critical blood shortage in our community. As we continue into the week, wash your hands, take care of yourself, wear a mask if you go out in public, do only what is essential, and remember, you're safer at home. Fighting this pandemic is in our hands right now. We can change the course right now if we choose to, and I encourage you to do that with us. Thank you.